Hi, Shea. Thank you so much for joining us today and for your willingness to share your journey into your specialty nursing career. I'd like to ask you to hit the high points of your career and tell us what led to your specialty that you're in right now.
Yes, thanks for having me. So my name is Shea. I graduated from the Demon program, which is the direct entry master's program at the University of New Hampshire. And currently I am working with the New Hampshire Army National Guard as a newly commissioned nurse with them for the vaccination efforts that are going across the state of New Hampshire.
Excellent. So, how long have you been in the Guard?
So I've actually been in the New Hampshire Guard for about 16 years now. So this is a new transition for me into the nursing role, as I've been a medic and flight medic with them for the past many, many years.
Excellent. So, will your new nursing licensure allow you to do some additional skills and tasks that you weren't able to do as a medic?
Yes. So, I mean, for the medic to nurse transition, I think that there's going to be a lot more case management stuff that we'll be able to work with soldiers who, because routinely we have soldiers who, have medical issues, and there's not a lot of follow up while, these issues are kind of happening while they're in the Guard. And so I think that some of the nursing roles are able to kind of, see the care progress through their time in, and what additional resources they may need outside of the Guard. And so that's why this is really nice to be able to have this new nursing transition role, where the medic role has been more or less of, taking vital signs and, a lot of hands-on patient care.
Mm. I think of it as more, yeah, kind of first aid and sort of in the moment care in a particular, wherever you're stationed, that kind of thing. Is that true?
Yes, I would agree. I think that the state of New Hampshire only has so many resources. So to be able to, take the resources that we do have and kind of be able to, grow on those, and being able to find those resources that soldiers may need is really important.
Excellent. Well, I've heard great things, and I've experienced firsthand. My daughter's a nursing student, so she was vaccinated by the Guard, and so they've just done an incredible job and really efficient and effective, and so really speaks to the skill and the organizational level that's happening there.
Great.
All right, so let's move on to the next question. Why is this specialty a good fit for you, and how did you decide that it was? And also, what's challenging about this specialty?
Yeah, so I mean, I think that there's a lot of challenges. I think it's taken me a long time to find this part of my journey. I think, you know, many years ago, before I joined the Guard, I had actually had a full scholarship offered to me for a nursing program. And I turned it down because I didn't know that I wanted it at that point. And now here we are, however many years later, and I'm kind of back in these footsteps. So I think that these past years have really kind of helped me learn a lot, and to kind of be able to see, what I want to, grow into in the future. And so that's why, like, that there's been a lot of challenges for me, just to kind of, uh, really try and figure out, what avenues I want to go through once I kind of got this nursing position.
Excellent. So I'm thinking that your transition is going to be a little bit non-traditional, since you're going to be pretty much deployed for the vaccination clinics. Um, is that through a certain time frame? Do you know when that's going to go through?
Yeah, I don't know right now, but I think, for a lot of the vaccination, relief time. I mean, I think we're looking into the summertime here, so I think it's kind of unknown at this point. But obviously we kind of help until we're not needed anymore.
Okay, great. That's excellent. So, obviously, COVID has influenced your practice significantly. Aside from completely dictating where your career was going to go, are there other ways that COVID's impacted your nursing career?
Yeah, I mean, I think that it's opened up a lot of people's eyes, and I don't even think just the nursing profession, but I think that for me, it's really taken me to look at maybe even down to the basics of how I wash my hands, how I really have every patient encounter, and then also the well-being, not only the physical well-being of people but the mental well-being of people, because I think that it's had an impact with people and their mental capabilities of social isolation, and kind of being able to view a lot of those challenges. I think that going forward, this is going to be I'm going to be able to relate to people hopefully a lot better. And then also with like learning about how the virus is so transmissible, it's really given me that extra kind of safety and assurance of like, okay, I really have to, make sure that I'm, you know, ensuring that I'm clean and that my patients are clean and that everything that I do um, is, so that way I'm not, really can, being able to pass along this virus or any other, bacteria or anything that we can, for any patients. So.
Right. As part of being part of the Guard, do they support you at all in terms of the emotional support? Anything specific?
Yeah, so we have, I think over the last few years, there's been a lot more focus on like the mental health aspect of soldiers, and there has been a lot of additional roles that have been, coming in. So I think we have mental health counselors available, 24 hours a day for all soldiers now. There's a complement of full-time staff as well. And these people are integrated, within the ranks of the soldiers. So it's really, really great to be able to, have these people here, with us, and they're easily able to relate to soldiers as well. So there's been a huge increase, with, mental illness and awareness within the National Guard.
Oh, that's excellent. I'm familiar with their Designing for Zero initiative to address suicide in the military, and that seems to be another big focus right now. That's great. That's really progressive thinking. So last question here. What advice do you have for new grads who are interested in your specialty? Specifically, any certifications, training, or experience that you recommend?
So, I mean, I think that if I were to give any sort of recommendation, I would say to get your hands on any sort of additional education or certifications that you can. I think any additional learning will help you later on in your career. And I think that a lot of, I feel like in the medical field, we maybe we'll do an additional course, and for the first, maybe an hour or a day of the course, it's a lot of, review. It's a review of anatomy and physiology. And I think that sometimes is a little challenging for us because we think, well, we've already learned it. Well, I think that even though we have learned it, I think it's a great review and familiarization. And I think that any sort of progressive learning and additional learning is really going to go very far for anyone, because I think really education is priceless. So if I would to make any suggestion, if there was any certification out there that you were able to, grasp onto, I would say to do it.
Excellent. Okay. Well, thanks so much again for your time today and sharing your knowledge and expertise. We really appreciate it.
Great. Thank you.